North Idaho's hospital crisis is only growing, and state officials say the area is suffering the most in the state. Thanks for joining us this morning. I'm Tim Pham.
And I'm Channing Curtis. Well, this morning we're continuing to follow the rising COVID impact in our region. Hospital staff members say they are just overwhelmed. 40 patients are in critical care this morning, and half of them are on ventilators. Nicole Hernandez is live at Kootenai Health again this morning, where an Army medical team has arrived to help out at the hospital. Good morning, Nicole.
Yeah, good morning, guys. So like you mentioned, it's a 20-person U.S. Army medical team that is here in North Idaho helping Kootenai Health with their patients here. So they're seeing a record number of COVID-19 patients, more than they've seen since the beginning of the pandemic. As of right now, they are sitting at 113 COVID-19 patients in their hospital, but the hospital is concerned that that number is going to rise, projecting that it could be up to 140 COVID-19 patients in the coming weeks. The Department of Defense team here has 14 nurses, 4 physicians, and 2 respiratory therapists. The team is going to help staff for at least 5 weeks as hospitalizations continue to climb.
We were delighted to see that the standard of care was exceptional for the patients admitted at this hospital. Despite the sort of unprecedentedly large volumes of patients currently being cared for, the staff, the nurses, the physicians have been able to rise to the challenge and fight the good fight. We're also incredibly fortunate to be able to be here and provide some much needed offloading of that stress on this local system.
Now, since the pandemic started, Kootenai Health has not once been able to shut down its COVID-19 unit. The hospital transitioned into crisis standards of care earlier this week to help ration its resources for those with high chances of recovery. At this point, of the patients in Kootenai Health Hospital are unvaccinated, and the Department of Defense team says that they are able to stay longer if they're needed. The hospital, though, is also looking for volunteers, even non-medical professionals, to help them out in this situation. In in Coeur d'Alene, I'm Nicole Hernandez.
All right, thanks, Nicole. So let's go ahead and take a look at hospitalizations in all of North Idaho. As hospitals are stretched to their limits, cases are also on the rise. The Panhandle Health District is reporting 117 people are hospitalized with COVID-19. 317 new cases were also reported yesterday afternoon as well, with no new deaths. So let's also take a look at the vaccination rate. So this map was just updated yesterday, but as you can see, Idaho's vaccinated population is still less than 44%. There are only a few states left that are in that same boat, and they're all represented in this gray. So North Idaho specifically has the lowest rates of vaccination in the entire state. According to the Panhandle Health District, only 39% of people ages 12 and up are vaccinated in North Idaho.
Well, COVID hospitalizations in Idaho are at an all-time high, but that doesn't mean Washington is in the clear. Hospitals across state lines are also approaching capacity. And now the huge surge in cases in both Idaho and Oregon, fueling concerns that more patients could be coming our way. Take a look. That blue line on the bottom is hospitalizations in Washington. Those 2 lines on the top there are hospitalizations in Oregon and Idaho. Both states have taken emergency steps to respond to that surge. In Idaho, Kootenai Health is running low on resources. The hospital is using conference and classrooms for COVID patients. Like you heard Nicole say, they also have an Army team working hands-on with nurses and doctors. So could patients from Idaho come to Washington for care even as hospitals near capacity? Well, the short answer is yes, but the state is under no obligation to them.
We have some special processes through the Washington Medical Coordination Center, and those only apply to patients that are in a Washington State hospital. That we are not sort of guaranteeing the help to anyone that's outside of Washington State.
Healthcare leaders are begging people to do what they can to prevent serious illness from COVID-19. Right now, the Spokane Regional Health District is reporting 212 people are hospitalized. 353 new cases were also reported, with 3 new deaths. So this week, we spoke with the interim Spokane Regional Health Officer, Dr. Frank Velasquez. He says the Spokane area hospitals are working hard to stay ahead of the curve so we don't have to go into that crisis mode.
They are managing by, flexing staff and et cetera, et cetera. We are not talking about crisis standards of care. in this region at this point in time. But I do have to tell you that's one of the areas that we've always examined. We examine all options, but right now our healthcare partners are managing. One of the advantages that we have in Spokane, which is we are a regional referral center, and that gives us the ability to have capacity that exceeds what you will need for a community this size.
Right now, Spokane County also has the highest number of COVID patients hospitalized that we've seen since the start of the pandemic.
Today, President Biden is expected to announce a new strategy to stop the spread of COVID-19. The announcement will include a 6-step plan to increase vaccination rates, keep schools open, and protect the economic recovery. According to the White House, the announcement will include new vaccine requirements as well.
Some of that will be related to access to testing. Some will be related to mandates. Some will be related to how we ensure kids are protected in schools. And
we're told the new plan will also include an update on booster shots. Now, our coverage on the hospital crisis in North Idaho will continue in our next half hour. But for the latest information, you can text the word COVID to 509-448-2000. We'll send you a link directly to your phone with all of the latest information.